Alright, my name is Natalie Butler. I'm going to be doing the head to toe for Nursing 612. This is my patient, my mom, and before we started I had her empty her bladder and change into comfortable clothing. We don't have a gown here. Took her height, weight, and vital signs all within normal limits. Did a general assessment and everything looks good. Appears well right now, alert and oriented. We also tested her vision using the Snellen chart for distance and the Rosenbaum chart for near vision. I'm going to begin by looking at your head. We're going to be looking at your scalp, symmetry of the ears and eyes, and everything looks good. Hair is nice and shiny and soft. The scalp, no bumps or anything like that. Any tenderness anywhere?
Nope.
Alright. We're going to be testing your cranial nerves. Can you clench your teeth for me? Alright. Shut your eyes very tightly. Perfect. Can you wrinkle your forehead? Alright. Can you poke out your cheeks? Smile for me. And stick out your tongue. Okay. All cranial nerves are intact. Good thing, right?
Yeah.
Next I'm going to be palpating the facial bones. Feeling for any nodules. Everything feels good. Any tenderness in your sinuses?
Nope.
Alright. Testing for TMJ. Can you open, close? Feeling for any clicking or popping, any tenderness. Alright. Next we're going to be doing a light sensation test. Can you feel that on your forehead?
Yeah. Yes. Yes.
Alright.
Yep.
Perfect. Next we're going to be going to your eyes. Visual inspection again. Eyelids look good. Eyelashes are good. Sclera is nice and white. I'm going to be palpating the lacrimal apparatus. Close your eyes for me. Alright. Feels good. No discharge or anything like that noted. Can I have you cover one eye? Looking for nystagmus in the other eye. Can you do the same? Perfect. No nystagmus in either eye. Alright. I'm going to just test your pupillary response here. Alright. Looks good, sorry. And then can I have you follow my finger? We're going to do carniophilic gaze. Don't move your head, just your eyes. Alright. Looks good. Okay. Ears, again symmetric as we looked at before. Palpate the auricle, no nodules or anything like that. I'm going to do the whisper test where I'm going to whisper a common word and I'll have you repeat it for me.
Apple. Orange.
Alright. And I do not have an otoscope, but I would pull back the pinna and look into the ear canal for any redness, any drainage, and look at the tympanic membrane and hopefully see a pearly gray, nice opaque tympanic membrane. And I would do that on both ears. Now we're going to do the Weber and the Rhine test. I'm going to strike the tuning fork and put it in the center of your head and tell me if you hear it in both ears. Alright. Now the Rhine test, I'm going to be striking the tuning fork. Tell me when you don't hear it anymore.
No.
Alright. And then here. That should be about 2 times.
Yeah.
Okay. I'm going to be looking at the nose. Looks good from the outside. I'm going to be inspecting the mucosa, the septum, the turbinates, no drainage, and the septum looks intact, no sign of deviated septum or anything like that. I'm going to test patency. Can I have you plug one nose? Deep breath. Perfect. Can you do it to the other one? Alright. Both nares are intact. Lips look good. I'm going to be inspecting the mouth now. Can you open up wide for me? Stick out your tongue. Alright. Uvula looks good. Hard and soft palate look good. No signs of redness, tonsils, inflammation, anything like that. Teeth look nice and white. Nothing missing and tongue looks good. Alright. Pharynx and everything looked good in there as well. And I'm going to be testing your gag reflex. Can you say ah?
Ah.
Alright. That is intact. Moving to the neck. Upon inspection, skin, everything looks good. No JVD noted or enlarged thyroid or anything like that. Excuse me. We're going to do range of motion. Can you turn your head for me? Other way, up, back. We're going to do it against resistance. Okay. Alright, both passive and active are intact. Can you show your shoulders for me? Perfect. And again, against resistance. Excellent. Palpate for the carotid pulse, one side at a time. Right. 2+ on each side. I feel the trachea here and the thyroid. Can you swallow for me? Alright. Looks good. I'm going to be feeling for lymph nodes now. You shouldn't feel anything upon exam. Pre and post cervicular, the occipital, the tonsillar, submental, submandibular, cervical chain, posterior cervical, deep cervical, supraclavicular down here, infraclavicular, and axillary. Alright. No tenderness or anything. I didn't.
No.
Right. Now we're going to be looking at your arms, looking at the skin, and that looks intact. And I see you got your flu shot.
Yep.
Alright, can I see your hands here? Okay, everything looks good. Nails look nice and healthy, and capillary refill is good. Alright, we're going to test your muscle strength. You lift your arms up for me and lift up against my resistance. Alright, can you grab my hands? Alright, equal strength in both arms. I'm going to palpate the brachial. And the radial pulse. Do that on both arms. Alright. Pulse is strong and regular on both sides. We're moving to the back now. For modesty purposes, I'm going to have the patient leave on her shirt, but I would be doing this without a shirt on for a normal exam to be able to look at the skin. Can you take a deep breath for me? Looking at thoracic expansion, and that's equal on both sides. We're going to be palpating CVA on both sides. Any tenderness noted?
No.
Alright. We're going to indirectly percuss. And you see pain if there was any type of kidney infection or a UTI there. Alright. While I'm back here, I'm going to percuss your back, test for diaphragmatic excursion. Listening for resonant sounds throughout. Deep breath for me and hold it. Listening for that change in sound, and we mark that place. And then can you exhale, please? Alright, let me do that on both sides. And make sure it's within normal limits. Next, we're going to be doing the lungs, and throughout the whole exam, we're always looking at respirations, making sure there's no extra work in breathing. Respirations look normal and unlabored. Chest wall expansion is equal on both sides. Then we test you for tactile fremitus. I'm going to put my hands in your chest and have you say 99.
99.
Alright. I'm also going to do it on the back. Okay. or throughout. Alright. Now I'm going to auscultate the lungs. Alright. Deep breath. Alright, I'm also going to listen posteriorly. Now moving to the chest, with the lung assessment, we also were assessing the chest at the same time. But again, there's no pulsations, no heavings noted. I'm going to palpate the precordium just to make sure there's no thrills, heaves, or pulsations. And then I'm going to palpate the left chest for the apical pulse. Okay. I'm going to palpate the chest, tell me if there's any tenderness. And again, we've been looking at the skin and everything like that while we're doing our assessment. I'm going to take a listen here to the heart sounds. Begin with the apical pulse. Pulmonic. Erb's point. Tricuspid. And mitral. Lastly, we're going to percuss the chest systematically. Again, listening for resonant sounds throughout. Everything looks great. Can I have you lay down so we can assess your abdomen? Assessing for any skin discoloration. The abdomen looks nice and flat and looks good. Remember, you're going to listen to bowel sounds, and sometimes you have to listen for a longer period of time. You may not hear bowel sounds. Normal active bowel sounds in all 4 quadrants. I'm going to turn and listen with the bell for the arteries and listening to the aorta, renal, no brewing noted in anything there. Move on to percussion to estimate the margins of the liver. Listening for resonant sounds throughout. You hear the gastric bubble. And then testing for splenic dullness over here. move on to light palpation. Asking the patient to note any tenderness or anything. Looking for any nodules. Open. Okay. Deep palpation, we're going to estimate the margins of the liver over here. Usually if there's any tenderness, the patient would stop you. Then trying to palpate the spleen, it should not be felt. Kidneys, again, are harder to feel most of the time as well. Palpate the aorta. Then can you raise your head up only and then we'll test the abdominal muscles, nice and strong. Okay, and then can I have you sit up? We're almost to the end here. Can you swing your feet around here for me? Alright. Pick up your pants here. And the patient shaves, but otherwise we'd be looking for hair distribution. Skin tone is good throughout. Temperature. And no edema is noted on this. Alright. I'm going to palpate the popliteal. Popliteal on both legs. Strong pull. Posterior-tibial. And then dorsalis medius. Alright, pulses are good throughout. Last thing we're going to be doing is checking your reflexes. Alright, brachial. Alright. Just one more. Knees. Sorry.
Nice.
Alright. And Achilles. Alright. And then, can I have you stand up for me for the last thing here? And we're going to be checking the spine. So going to have you lean forward a little bit. Checking for kyphosis and any scoliosis, and the spine looks great. And that concludes my exam. Fabulous.